We're basically, Roberta is a very lovely patient over here, and you know, she's been with us a number of times. She's quite beautiful. She's got great facial symmetry, great facial skeletal structure. However, she looks much younger than her age, but at the same time, she's also very, very natural, and we want to keep her that way. So that's the reason why she's here. That's the reason why we're going to be injecting calcium hydroxylapatite for her. What are we going to do today, Roberta, is that I'm seeing a few things, okay? And at the same time, I want to know whether you see the same things too, okay? Tell me what you don't like about yourself.
I think the eyes are a little bit deep.
Okay.
And I wish here a little bit more volume.
Okay.
And I see here.
On the lines over there.
And
a little bit there.
Yeah.
Okay. All right. I can definitely see that. Now, it's very important to know that since we're going to be injecting calcium hydroxylapatite today, is that you want to try to avoid the tear troughs themselves. You're not going to be injecting it. However, you can always inject the cheeks, and then you can actually, what we call the push bolus technique. You put a little bolus right over here, and you simply kind of push it a little bit towards on the upper side. Okay? Calcium hydroxylapatite is a white material, so it won't have that Tyndall effect with the thin skin of the eyelid, and it'll definitely fill up this area over here for her. Now, she might need a little bit of an HA sometime later on in the future, just a little bit on the sides there, but she may not, just by injecting the calcium, you know, the Radiesse itself. Now, you definitely have a little bit of crow's feet, and we can get rid of this using a botulinum toxin, okay? So, but we're not going to be doing that today. So what I'm going to be doing today, what I see, is what you just showed me. So we're going to try to correct this by creating that curve going here and at the same time going there, and try to keep it as natural as possible. Hopefully that'll give us a little bit of a lift, okay? That'll kind of make us use less product on the sides over here. And at the same time, we're also, now I'm seeing your chin is very, very nice, okay? We're going to kind of chisel it a little bit more on the sides here and a little bit more on the sides there, just to kind of give it a very
just shape it.
Just kind of shape it just a little bit more. Okay. Now, one of the things that you can inject calcium hydroxylapatite with, you know, the area is the temporal areas, and if you can see Roberta here, the temples, okay, are a little bit sunken. Okay, this is very, very normal. It's basically one of the signs of aging. So you want to give a little bit of volume in the side over here, and you inject a very, very small amount of Radiesse. That's put very, very deep, right where the muscles are. Okay, and by putting that area over here, you fill up this area so that you have this curvature going from here towards the zygomatic arch. So that will basically kind of get rid of the hollowness over here, give her a fuller, much younger look. Okay?
Okay.
All right. Okay, it's always very important to assess the patients while they're sitting up. Now I know exactly where she needs it. I'm going to be putting it where she requires it. Now, a lot of physicians usually mark the areas. It is not wrong to mark. Okay, so marking it with a surgical marker is completely fine. I tend not to do that. I like having my eyes basically do the talking for me, but it is not wrong using a surgical marker, especially if you've just started, and especially if you want to know exactly where your bony markers are or your facial anatomy markers are going to be. Okay, so we're going to treat the hollowness over here, and this technique basically is going to be a little bit different than the previous one. I'm not going to approach her from the center over here because mainly, you know, her cheeks are completely fine. She just has a little bit of hollowness mainly on the sides of here. So we're mainly going to be injecting right on top where the hollowness is, where the defect is. And we're going to be doing the bolus push technique. So we're putting a little bit of the material. I usually like to fan things. So with the same insertion point, I tend to turn. And I do the same thing, anterograde and retrograde. Always, always, my non-dominant hand, as you can see, is always touching the globe. I'm protecting the eye, plus at the same time, I'm not allowing the filler material to kind of seep into the globe itself. Now, to avoid bruising, usually you tell your patients to stop taking non-steroidal anti-inflammatory drugs, such as aspirin, such as things that contain ibuprofen or, you know, naproxen, for about, you know, some people say about 3 days to a week. I usually tell my patients to stop them for about a week. Now, certain supplements such as ginkgo biloba can, and at the same time vitamin E can also cause thinning of the blood. So, and that increases the risk of bruising. So you always tell your patients at the same time to try to avoid that too. Now that's I put in a bolus, and I'm basically going to try to kind of massage it into the area. We've injected about 0.5 of the material. I like seeing my patients from different angles. One of the best angles that you can actually assess patients is coming from above. Massaging is going to be very, very key. See, I'm pushing the material to go up. While I'm massaging it, I'm pushing the material to go up, right where the defect is. Did you feel any pain, Roberta?
No,
everything okay?
Not at all.
Good.
It's not painful.
All right, Roberta, I'm going to ask you to sit up for me. This one is still over here. It's kind of sunken down, but this one is much less diminished. So now we're going to be injecting the left side, and it's going to be very similar towards the right, and you want to try to compare it. And the easy thing is that you just move to this area. You can see it from this point of view, and then you can go back and insert whatever product that you need the most. All right, so it follows the same technique. I see the defect right over there. So I'm going to try to trace where the defect is, and I'm going to be injecting the material right there. Same thing, I like doing the anterior grade. Put a little bit of anterior grade. And come out. And fan it slowly. Come out. Very good. Okay, so massage, massage, massage. Massage is very, very key here. I'm going to move her. I see that there's a little defect right over there. I'm going to put my bolus right where the zygoma is. Feel the bone, just a tiny amount. Give it a little good bolus push. So we've done her cheeks, only 2 insertion points, and like I said, it's mainly the bolus push technique. So we put the bolus in, and we're going to try to push it up a little bit. We're going to keep on trying pushing it up. I do not inject the tear troughs whatsoever. You also should not inject the tear troughs. What happens basically, the area can calcify and can be problematic.